Guys, Dr. Tim here from Pop University inside the lab, spinning off of our lecture related to structure and function of the shoulder, and still continue with some mobility drills that could be helpful. So in previous lab assignments, we've addressed thoracic spine opening, pec and lat opening. Deeper structures will be capsular structures, which would be structures that are not contractile tissues, but they're structures that would keep that joint deep in socket, and if they're too tight can cause pain. This is definitely something though that you can overdo. So this is something where if you have symptoms, and like a good test is a shoulder impingement test, where you could tell that the capsule needs loosened if you touch your opposite shoulder and raise to your forehead. So if I find a restriction inside of that, these would be worth hitting. So one, is I take the band and I loop my hand through and let it fall over the band. That's an easy way to relax the shoulder. I then take the band and I step on it with my left foot, it's under my foot. I step on it with my right foot, being my right shoulder. You feel that tug down and I exhale. Exhale, I kind of relax my shoulder, let my trap kind of decompress, the shoulder be pulled, and I lean to the opposite way. I feel a very vague, diffuse, but good stretch into a deep portion of the anterior portion of the structure, where if your scapula sits like this, and that little hook is the acromion process, which we talked about in the lecture, your shoulder sits here, your humerus, and that space is called your Codman zone, and that Codman's critical zone will be opened up with that side bend movement. Another way you can mobilize the shoulder itself, which is for the capsule, is by taking the band, looping around so it's not going to move on us, opening up that loop. I slide my arm all the way down and have that band up deep into my axle and my armpit. I then kind of go relax the shoulder. I hold stability in my arm to give me some just some comfort here. And all I do is I do a traction mobilization where I feel my shoulder being pulled out of socket's dramatic, but away from the socket and into a traction position. So the first one is an inferior glide. You can probably hold that guy for about 20 seconds. And the second one is a traction glide. Hold for 20 seconds as well. Like I said, this is something that this impingement will feel smoother. Mine is right away on that right side. I'll probably have to do on the left. But it's something that opens up that zone of impingement and also decompresses the capsule and gives you better overhead mobility and decreased shoulder dysfunction. So I think you guys will really appreciate that one. You can overdo it if you don't have tension with this test. Not worth doing.